We got some rare and long-awaited good news today in the fight against the coronavirus. The FDA is approving one of several experimental treatments after a promising study that was excitedly announced by Dr. Anthony Fauci.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important. What it is proven is that a drug can block this virus.
Researchers have found that patients on remdesivir have recovered 4 days sooner on average than the placebo group. So that's the good news. The bad? Evidence is growing that the number of people who've already died from COVID-19 is likely a lot larger than we thought. There could be as many as 9,000 misreported deaths from the 7 states hardest hit by coronavirus, according to a new report from the New York Times, which compared average death rates to those we've seen over the past few weeks. More than 6,000 of the potentially misreported deaths were in New York and New Jersey, and around 500, according to the report, were in Massachusetts. At the same time, we're learning more about the scope of the financial toll the nationwide shutdowns have been taking. A report out today from the Commerce Department shows the economy shrank by nearly 5% in the first 3 months of the year. It's the worst single quarter drop since the financial crash of '08, and it's just the beginning. These numbers only go through the end of March, when most stay-at-home orders and business closures were just starting to take effect. By the end of the next quarter, economists predict a drop as much as 30%, the worst since the Great Depression, and unemployment projections, they're no better.
I think by June, I think that we're looking at numbers between 16 and 20%. The unemployment rate at that point will be something that's about as high as something that we haven't seen since, the 1930s.
It's why some states, like Georgia and Florida, for example, are reopening businesses and easing up on stay-at-home orders now, even as public health officials warn they haven't done enough to control more outbreaks, something Governor Charlie Baker said again today that Massachusetts hasn't done yet either.
We have not yet seen the downward trend that virtually every analyst, public health expert, federal official, and CDC official has said is a critical part of making the decision to move ahead and reopen. Moving too quickly runs the real risk of creating another outbreak, which will put people out of work, overwhelm our healthcare system, and put us right back in the public health crisis that we have all worked so hard to get out of. When we take a step forward, we don't want to take 2 steps back.
But while Baker just extended the shutdown here for another 2 weeks, neighboring Rhode Island is in a much different place, with testing there at a rate more than 3.5 times the U.S. average. According to data from the COVID Tracking Project and the New York Times, they're looking at a phased reopening beginning the end of next week. But they're not, to use an overused expression, just flipping the switch. Here to explain is the governor of Rhode Island, Gina Raimondo. Governor, thanks so much for joining me. I appreciate it.
Hi, Jim. Happy to see you.
Good to see you, too. So if all goes as planned and the people of Rhode Island play by the rules, what happens on May 9th?
Yeah, that's a big if, by the way. But if all goes as planned, then we're going to enter into what I've called phase 1, which is some limited reopening of offices. I'm going to lift the stay-at-home order. We're going to allow social gatherings of 10 or fewer, and we're going to, start a gradual phase-in of our economy.
Ashish Jha from the Harbor Global Health Initiative was here the other night, and when I asked him, is any state meeting the testing threshold that you think is necessary, the one state he mentioned was yours. Is the testing rate what caused you to make this decision to put you ahead of the rest of the Northeast?
It's a big part of it. Part of it is we are seeing that we've plateaued. So we track hospitalizations every day. They've plateaued. Number of new cases has plateaued. But the other piece of it is, I needed to have some confidence that our healthcare system was not going to get overwhelmed. Our testing was where it needed to be. And the testing's a big piece of it. It's going to allow us to know, where we are as we reopen.
But, you just use the expression plateau, which is the exact same expression Charlie Baker is using. You're talking about hospital capacity. Charlie Baker describes that every single day, saying almost half the hospital beds are available. So why did you have one reaction, a response to a similar set of circumstances compared to what Governor Baker is doing?
That I don't know, and I am not an expert on Massachusetts, and I certainly trust Charlie's judgment. We talk all the time. I can just tell you what's happening here. You know, we're seeing, like I've already explained, you know, cases aren't going up, hospitalizations aren't going up. We have ample capacity in the hospital. We are testing, as you said yourself, the most per capita in the country. Our contact tracing is in a really good place right now. We've partnered with a number of different companies. Our contact tracing is excellent. We can test everyone within 24 hours. We do contact tracing within 48 hours. And frankly, Jim, I have an economic crisis on my hands. You know, I'm not sure what's happening in Massachusetts, but I have 180,000 people who filed for unemployment insurance in the state of 1 million people, and we can't ignore the very real economic hardship.
That's another area where you're leading. Roughly a third of your workforce has filed for unemployment. How much of a factor was the economic crunch in your May 9th decision?
It's certainly a factor. I am never going to do anything at odds with the advice I'm getting from my director of health or the CDC. Having said that, look, there's a relationship between economic health and physical health. And when you have 180,000 people out of work, that's going to affect people's physical health as well, and so it weighs on me.
You know, but it seems like an odd juxtaposition. Again, you're talking about beginning, potentially, a phased reopening, 10 days, 12 days from now. And then this afternoon, you announced the cancellation of 2 of the jazz and folk festivals, huge moments for Rhode Island, 3 months away. Why didn't you wait for that?
Because I'm hearing, you know, we're in touch every day with folks who run these big venues, and they need to make their decisions. You know, they need to pay their vendors now or not. You know, they need to get their business decisions made now. I cannot see a world in which in July I'm going to be in a position to allow an event with 50,000 people. You know, that's an event with 10,000 or more people congregating in close proximity on the lawn of Fort Adams. That's not going to be safe. So I just felt it was right to let them do their planning.
So in the New York Times the other day, a professor from Brown referred to you as a no baloney technocrat. I think he meant it as a compliment, by the way. I think you're smiling, so I assume you did. But does a no baloney technocrat experience self-doubt? I'm not minimizing all the other decisions you make, but these decisions are life and death decisions. The other ones you make matter, but they don't rise to this level. Do you experience self-doubt? Do you question yourself as you go along?
All the time. All the time.
How do you deal with that?
Honestly, if anyone tells you they don't, they're either not being thoughtful enough or they're not being honest. Yeah, what I do is I ask myself every day, is it the right thing to do? And if I feel like I get it wrong, I go back and I change it. But the hardest thing about this, Jim, is that we have to make decisions so fast with imperfect information that affects people's lives. So you do the best you can. And if later the new information comes out that you made a mistake, you have to have the guts to make a change in the decision.
Does it ever paralyze you, the worry about these kinds of things?
No, I have to say no. And frankly, because if you're a governor, you don't have that luxury. Even if you want to, you got to keep going. Every day, keep going.
Speaking of governors, you got in a tiff with a pretty high-profile governor from New York not too long ago when you talked about quarantining people from New York who entered your state. Fast forward to May 9th. You're ahead of the rest of the Northeast and the bordering states. When someone comes in from Massachusetts, which is obviously behind you by at least a week or so, maybe longer, what do you do to them?
In phase 1, we have said the travel policy is going to be the same. So if you're coming here for work, you know, that's fine. You come here for work and go home. But if you're coming here socially, and you plan to stay, you have to go into quarantine for 14 days.
So a recent poll out of Bryant University, we're going to put it up, says that 81% of the people in your state think you're doing a good job. Only 34, I think it was maybe 36%, somewhere around that, said that Trump is doing a good job in coronavirus. And by the way, that lower number is pretty much what your approval rating was before coronavirus, as you know, despite winning 2 elections. What happened? Are you governing differently, or are the circumstances allowing the people in your state to see you differently in a crisis?
Yeah, it's definitely the latter. I certainly haven't changed the way I'm governing. I think it's exactly what you said. People are having the opportunity to hear from me more often. And, people are looking for someone to make them feel safe. And that's what I try to do every day. Just make people as safe as possible. And I think people appreciate that.
Speaking of constituents and how they feel, I know in early April you did an event for kids. I assume that was to get away from reporters. I don't know, and I know you're doing another one tomorrow. You apparently received 15,000 questions for the first one, and I think it's your husband who reads the question. Here's a little bit from the first one.
Molly, a first grader in Cumberland, asks, are a lot of people getting better from the virus?
Yes, Molly. The good news is most people are getting better. And the really good news is kids aren't getting very sick. So for the kids out there, I don't want you to worry about getting corona. We have some of the best doctors and nurses in the world working right here in Rhode Island. So even if you get sick, chances are it's going to be just fine.
Why'd you do those? Why are you doing that?
Because kids are nervous too. My husband and I have 2 teenagers. They're worried. They're nervous. They're asking a ton of questions. And we wanted to speak directly to them. Also, it's a good learning opportunity. I have 142,000 kids trying to learn in their houses. So this was a great learning opportunity to prepare, to ask their questions, and interact with the governor.
A lot of people are also nervous, adults as well, about the future direction of the country. You endorsed Joe Biden. As we know, he has said he's going to pick a woman. Who should he pick?
Oh, that's his call. That is his call. But I'll support him and whoever he picks.
Tom Friedman from the New York Times had you on a list of 3 people from which he should pick. If he asked you, would you give the same answer that Elizabeth Warren and Stacey Abrams have given? They gave a big yes. What would you say?
They gave a big yes. I'm not going to answer right now. I'm in the middle of fighting a crisis and not thinking about politics.
Last minute, Governor, if you would, do you think about Rhode Island 6 months from now, a year from now, after the vaccine, assuming there is one? Do you see it as returning to what Rhode Island was, or do you see a different kind of Rhode Island down the line?
I want to see an even stronger Rhode Island. I am really hopeful that we're going to come out of this even stronger. I want to see small businesses be more technologically capable. A lot of them are getting hurt right now, not technologically capable. I want to see more Rhode Islanders upskilled so that they have more technology skills, for example, and better credentialing to get a good job. I'd like to see our infrastructure a bit stronger. I want to see some innovations. I hope some new companies come out of this that create, touchless technology. I hope our healthcare system is stronger. I hope we have less dependence on nursing homes and more dependence on community supports and, at-home care. So, listen, we have a lot of wood to chop to get from here to there, but we're going to get there. And I really do believe we'll be stronger and more creative and more skilled on the other side of it.
I hope you're right. Gina Raimondo, good to see you. Thanks so much for your time.
Thanks,
I appreciate
Jim.
it. Thanks.
Thank you.